we're going to, when we see our victim, all right, down, we're going to assess the situation. You always keep your safety in mind first, okay? You never want to put yourself in danger, right? Annie, are you okay? Are you okay? And then you're going to pick someone. Jennifer, go call 911, get the defibrillator, and come back. And once you've determined that they're not responsive, you have a medical emergency. So you want to activate 911. Doesn't mean that you're going to have to do CPR immediately. We'll check for all of the signs and symptoms of CPR. But we're going to activate 911. Once they're unresponsive, we're going to activate 911, get the defibrillator, and come back. Okay? Then we're going to look, listen, feel. Remember, we're going to get down. We're going to put our ear right near the victim's face. We're going to put our cheek right next to their mouth. We're looking for signs of life. We're looking for the chest to rise and fall. We're looking, we're listening to hear any air exchange, and our cheek is right there to listen, to feel any air against our cheek. Okay, so we're going to look, listen, feel for about 10 seconds. There's no air exchange. Okay? So we're going to breathe for our victim. Remember, when we breathe, we're going to do the head tilt, chin lift. Okay? We put 2 fingers, and only 2 fingers, because you don't want to close them out, on the chin. This hand goes on, the palm of your hand goes on their forehead, and you push the head back. Now on the mannequin, you really got to push it back pretty hard. Okay? So you're going to push the head back, and you're going to pinch the nose, and you're going to deliver a breath. If the first breath doesn't go in, remember, we're going to reposition the head and try again. Once we get a breath in, we're going to watch the chest is going to rise. You're going to allow the chest to rise and then fall. You want enough air that you allow the chest to rise, but also let it fall. Deliver the second breath, and then we're going to look for signs of circulation. Okay, remember, when we look for signs of circulation, we're looking for discoloration in the face, the lips, the extremities, the cheeks. Okay, we're looking for signs of circulation. Once there's no circulation, we're going to go ahead and compress the heart. Now, what we've done by putting air in the victim's lungs is we now have air in their lungs. We want to now circulate that oxygen-rich blood throughout the body. We do that by doing our compressions. Now, if you remember, we used to do this back in the day. Right? We're not going to do that anymore. We're just going to landmark across the middle finger, across the nipple line. We're going to raise our fingers. We're going to interlock our fingers, and we're going to lean over the victim, and we're going to apply compressions. How many? 30 compressions, 2 breaths. 2 breaths. And for our adults, how far down do we want to go with our compressions? 1.5 to 2 inches, okay? And it doesn't matter which hand you want to put on the bottom. It makes no difference. Use your dominant hand on the bottom. And we're going to go at a rate of about 60 compressions per minute. 1, 2, 3, 4, 5, 6, 7, 8, and 9, and 10, 11, and 12, and 13, and 14, and 15, and 16, 17, 18, 19, and 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2 breaths, and continue.